moderador de la actividad, el señor Máximo Manzi, director ejecutivo de la Cámara Costarricense de la Salud, PROMED, quien será el moderador, y nuestros panelistas, la señora Gabriela Couto, CEO of Marketplace and President of the Costa Rica Biomed Cluster, el señor Ricardo Salazar, Head Government and Public Affairs and Advocacy for Latin America, Sanofi, y el señor K.P. Bananje, Senior Director Consulting Services de Neosoft América. Bienvenidos y muchas gracias por acompañarnos esta tarde.
Good afternoon. I think that the first big news is that there are also opportunities for outsourcing and offshoring in healthcare. Those that have been, that had the pleasure to attend Outsource2LAC during the previous years, they realize that, of course, there are areas much more developed than others, but healthcare, without a doubt, is an area where there are growing opportunities. During this panel, we will try to provide an overview about what or some of those areas are and see which are the opportunities and of course, which are the business models and what the Latin America region should do in order to be a much stronger actor in this industry. So among the areas that we are going to cover and that are part of what has been also called the global healthcare industry, we can name a few. One of those is everything related with research and development, including on the, for example, on the medical devices side, anything related with designing new devices, prototypes, and of course, everything related with clinical trials in order to have the possibility to commercialize those devices, and of course clinical trials related with any pharmaceutical companies that needs to go through the different phases of safety and security. Another area quite strong and that has been in place since thousands of years is the so-called medical tourism. Another way to see medical tourism is an outsourcing of services. And now patients are not only traveling based on individual decision, but we are experiencing, for example, in Costa Rica, big employers from the US that are sponsoring or paying for healthcare services in other countries. And also what is called the healthcare BPO, we can think on areas like imaging lectures and medical transcriptions, or on the side of payers of healthcare services, areas like insurance reimbursements. So that's another area of BPO that there is a potential in it. And in addition to that, and we will be focused quite much in what is called in general digital health, from telemedicine, or digital health, anything or any way that the technology can help the health of the people. One strong area is related with artificial intelligence. Think of big hospital systems that are starting to put in a computer data of millions of patients and having the possibility to take decisions not only based on the experience of a medical board, but also on the results, how those millions of patients have been treated and having a much better treatment plan for those patients. And last but not least, anything related with medical education. So simulation now, well, we are quite lucky, the patients of this area, that doctors have the opportunity to train not on human beings, but on machines. And all these areas of medical education that's also part of all these global healthcare industry. We have a great panel with us, so let's start with Gabriela. I would like to start and see what is driving the outsourcing market in bioservices, and let's try to see how what are the main opportunities and trends in this area. Gabriela.
Good. Good afternoon, everybody. I hope everybody's awake as well. Imagine what you had on your plate today is probably something that some of you will be thankful that you're taking a pill that lowers cholesterol level, for example. Any of us either take a pill of something that was eventually made through biotechnology and has been followed down the way to the value chain to get into the market, a pill that we consume by the pharmaceutical companies. Well, I just wanted to position ourselves in this because we're a diverse audience here. I know many of you are already from pharmaceuticals, but most are IT-oriented. So the idea is for this to get to your table today, that means a long process that in many cases, not all of them, it takes 10, 20 years of research and development, clinical trials, and all the rest of the processes of manufacturing and specialized distribution to get to all the world. So, and many times this costs $1 billion. So, not in all cases, but just placing this as a setting, what is the pressure and what is the, what are the drivers that are trending new issues? And basically, obviously, if there's so much pressure, time is money. Anything that can reduce the time from research to market is absolutely one of the money savers that all of the actors from the biotechnology companies, the research and development institutions, all the clinical organizations, and the big pharma, all of those are trying to save at one time. So time is one. What facilitates time? When the countries have regulations that are facilitating the approvals or facilitating the timing to be able to start clinical trials, for example. This and many other things are less time consuming. Also, what is the trend is to try to reduce risk, obviously, because there is so much time, so much money involved. To reduce risk, what big pharma are doing now is partnering with biotech companies that already have a development phase much more advanced, or they're trying to say, okay, let's couple up, but we'll pay this if we reach this. So there's a different negotiation that's working on that as well in order to reduce risk, reduce costs. So basically time, risk, reduce costs, these are the new trends.
Great. Thank you, Gabriela. Well, KP, so what's the role of, you come from the IT sector, so what are the new business models that you're seeing in this also quite disruptive area that's global healthcare or NBIC?
Sure. Let me step back for a minute and talk about how this healthcare as an industry evolved over last 2 decades. In the US, if you look at, or even in any of the developed markets, we have sailed through the first wave of healthcare, where most of the legacy systems or paper-based systems transformed into a new set of IT systems, either through a upgrade or a set of new applications getting created to manage all the electronic medical records. We have seen a lot of new services, associated new services, born during this evaluation time frame. However, this actually also provided a lot of new business models, and lot of benefits, advantages are also taken by services industries. Try to in collaboration with product companies in the healthcare IT space. This is not only in the US, also in some of the developing markets today. You see a lot of IT systems are becoming a lot more matured over time, and today, if you look at, and of course, there is a traditional business models like and time and material based or fixed price based projects, which are traditionally followed by services companies to support product companies which are in the healthcare space. Today, if you look at, I think healthcare space, healthcare industry is been lagging behind in terms of making use of data, and especially we are living in a data-driven economy. I believe that we still have a lot more to catch up, even in the developed markets like US. We see a lot of new companies, new startups trying to make use of this data to get a lot more insights about healthcare, which is today you're talking about, you're working with peta-size data, which is coming from not only IT systems, applications, also from a lot of sensor-based devices, Fitbits of the world, a lot of other wearables devices where you collect so much of data, or this acquisition of this data and analysis of this data in real time is what is going to make a lot of difference. And these insights are still not fully trustworthy. If you look at, if you are used to wearing, Fitbit or Galaxy S3 or any of the wearable devices, the data what is being presented to you, it's beautifully visualized through your handset or a mobile phone, or even on your laptop. You can see the trend, you can see the summary for a month or for a week. However, we are not making use of this data at the moment. Physician can see this data see these insights as a second opinion or a secondary opinion to understand or to learn more about the patient, but we are not really making use of this data as a decision-making system. So in my view, there are enormous opportunities to look at this disruption happening within healthcare and look at what are the new business models can emerge out of this healthcare industry. In my view, there are some experiments done today looking at value-based or outcome-based business models, engagement models. I also believe that there are a lot of new startups having unique capabilities or complementing capabilities, which probably large IT product companies might not have it at the moment. They are much more proficient, efficient in terms of making use of analyzing the data in real time and providing some insights. I believe that these partnerships with these companies, which are startups today, and they are looking at penetrating to new market areas, not only developed world, also developing worlds like LAC region. So partnerships, the partnership model will actually work for a lot of small and medium companies, not only large companies, in terms of acquiring some of these tools, digital tools or healthcare tools, and trying to figure out what insights you can actually bring in, what value you can bring in to a healthcare provider in your local market. So my recommendation to a lot of entrepreneurs in this region also to open up their views, open up their market, open up their reach out to some of these startups in the developed world. I come from Silicon Valley in California. I see a lot of companies who are really looking at structured as well as unstructured data sets to understand how they can bring value or new insights in the healthcare market. So not only traditional business models, I believe that partnerships, I believe that value-based or outcome-based service models will have a lot more advantage for a small and medium companies, including startups in this region, to have more customers and serve more customers in a very effective way.
Thank you. Dr. Salazar, you come from one of the most regulated industry on the planet, the pharmaceutical industry. So, in your opinion, what's the role of economic and health policies in the region to make the region a more attractive destination or provider of healthcare-related services in a highly competitive way?
Okay, thank you. Good afternoon, everyone. It's a big discussion, but in order to be concrete, I think in three verbs: harmonize, promote, and control. Harmonize in terms of the correct harmonization of the policy based on the fundamentals of the business models, particularly in terms to unify the real needs of the business model across the different countries, especially thinking about the trade agreements. For instance, Pacific Alliance, Mercosur, ALBA, is very important to maintain very good capacity to harmonize this kind of policy across the different barriers, across the different policies and regulation to amplify the real opportunities to import, to export, to grow, and to maintain the correct statement of this kind of processes and business. The second one, promote the integration between three actors: the public sector, private sector, and the academy. It is crucial in order to activate the industrial phase of the knowledge. As you know, the innovation has value when the people use the innovation. For that reason, it's necessary to guarantee the funding process and the activation of this industrial phase. And the last one, control. In Latin America, it's very relevant to optimize the control in terms of bureaucracy. Remember those things in process, duplication of the activities, the corruption is very difficult in our region, and I think that the legal stability in order to guarantee the capacity for an investment, especially in these 3 points.
Thank you, Doctor. And following with this discussion, and maybe more from a business point of view, Gabriela, is Latin America prepared to compete in this bioservice market that you are leading, a cluster here, a biotechnology cluster in Costa Rica? So how do you see the region in terms of preparedness to compete and to be one of the leading actors in this industry?
Well, the good news is that pharma is turning into biopharma, which is turning into personalized medicine. So that means what used to be huge statistics now is huge statistics of specialized treatments and specialized diagnostic accompanying the treatments. So this gives an array of opportunities for the countries that were in the shorter market share. Let's say today, most of the clinical trials, for example, which is a huge part of bioservices, half of it is in the United States, 1/4 is in Europe, and another 1/4 is shared between Asia, Latin America, and Africa. But Latin America is increasing. For one thing, biopharma is seeing that the need for studying a larger ethnic group is very important. Another thing from our side, we're also updating either the regulatory paths or the laws. For example, the Minister of Comercio Exterior?
Foreign Trade.
Foreign Trade, thank you. Just gave the presentation this morning saying in 2015 we have one of the pioneering laws for studying biomedical studies in humans. So Costa Rica has shortened the procedure for approval to start clinical paths to something like as short as 2 weeks to 2 months compared to other countries, for example, Brazil, that can take 6 months to 2 years. So this is a plus. This is something we're trying to build on. And also, what my colleague was mentioning, you need to integrate and you need to do this network, harmonize. So everybody has to be on the same table and understanding the flow of what's happening and understanding where are the obstacles and trying to get through these things together. Together, government, industry, and the university. So this is where small is beautiful comes in, right? I mean, Costa Rica has that advantage as well because you can have first-hand access to anybody from president down to start dealing with these things. There are other complications, nothing is perfect, but I mean, at least this is the path that we're seeking and putting many diverse actors on the table at the same time. So, for example, the cluster that Procomer is supporting us, our cluster is called Costa Rica Biomed. It's an association of biotechnology and medical device companies that are dedicated to R&D, research and development. We're very few, but we're growing. And the idea is now we have a voice and everybody wants to be part of this discussion. So Ministry of Economy is interested, Ministry of Health is interested. So now we can dialogue face to face and try to get together these ideas of how to solve.
Perfect. Thank you, Gabriel. KP, let's get back to IT. So what can we learn as region, as Latin American region from learning adapter like China and India about how IT firms, about their expertise can bring in added value to this global healthcare industry?
Sure. I think this is one of the challenge. I think you're referring to capabilities, how you build capabilities within the organization. I think this is one of the challenge which I think most of the panels in the morning sessions also discussed. Traditionally, if you look at any of the outsourcing or services companies around the world, the capabilities are built, or the resources, the skill set are built within the organization by delivering or by doing projects, by participating in clients' programs, and building capabilities through working on developing products, working on new skill, acquiring some new skill sets by providing some solutions. And traditionally, this has been the process of, or a framework followed by all the services companies to build capabilities and skill sets. However, today, if you look at again going back to data-driven economy, I believe that any company today, whether it's a startup or a large organization, without having a center of excellence for machine learning or center of excellence for data science, probably will be wiped out of the market in few years from now. In my view, every company need to adapt to develop some skill sets and capabilities around machine learning and data science in various different practices they have, irrespective of whether they have one specific focus, industry focus, or they have multiple industry focus. Most of the startups today look at data as a real asset, and data, building data scientists or skill sets around machine learning is one of the core prime activities. And I believe that most of the product companies also start following the same trend. And I see that Indian and Chinese outsourcing companies who are today in the market for last a decade or so, or 2 decades, especially Indian companies, really focusing on looking at developing some center of excellence around machine learning, or acquiring some companies who are really having these capabilities. I think I'm not sure how LAC region or companies, entrepreneurs, or the current small and medium companies in this region are trying to get into this, building up these skill sets. However, I have been engaged with multiple small, medium companies in the last two to 3 years in Costa Rica. And one of the success stories which I have seen in last 2-3 years that the company is really focusing on looking at skilled resources and really investing time and effort in building some of these skill sets, thinking that this is something going to be the core skill sets and capabilities they would like to have in terms of to support some of the customer programs. I think this also drives them to figure out how business value they can bring in apart from doing a regular projects, regular solution development for a particular client. They are also able to look at, since they have an access to data at the customer side, they are able to develop some of the insights for a specific programs or a specific solution. They are able to provide some insights on what is happening and what we can do better for a specific product or a solution. So I think that actually adds a lot of business value for a customer, and it also builds over a period of time. It also builds some capabilities within the company. I think that traditionally, the framework of building capabilities or creating center of excellences within the product companies, the same thing can be followed by small and medium companies in a limited way.
Thank you, KP. Dr. Salazar, if you were to recommend to all the countries that are here from Latin America about the structure, about how to structure the model, for example, in the biotech industry, do you believe more in a kind of centralized biotech institutes model, or more on kind of integrated network of strategic thinking and development? What do you think would be like your recommendation to other countries?
Absolutely the second one. The integrated networks could be the best response in order to provide the real answers as a whole body for thinking in terms of the needs of the population. It's so difficult to centralize the answer and the questions in terms of biotech, in particular in the healthcare systems. I think that is the perfect environment for outsourcing and offshoring models, and especially for building a smart alliance. For instance, Google, Microsoft, and Twitter has a lot of alliances with biotech in terms of the healthcare. Sanofi, the company that I work is very proactive to establish network with Google, for instance, to provide new information management models in diabetes, for instance, new devices and new forms for managing the knowledge for the patients, to build smart patient journeys and other kind of new developments. I think this second one option is perfect to build more capacities, wide capacities, but with complementary and diverse skills and knowledge across the region.
Yeah, KP, you wanted to add this? Yeah. To add something.
I just wanted to add one other comment on, as a closing note. So going back to the building capabilities, I believe that a few years ago or a decade ago, when I graduated, if you want to run through some of the or visualize some of the algorithms or some of the machine learning techniques, you can only write on paper or run through some small programs. But today, if you look at, there are so many open source APIs and platforms available for any developer or any engineer to take a set of structured or unstructured data sets and run through some analysis and visualize and make sure that some of the algorithms or some of the techniques what is being used is really working, right? So he can actually confirm some of these things before even he go and implement in real time. So I think there are enormous opportunities in this space. I really urge the local entrepreneurs to reach out to some of these companies, reach out to some of these open platforms we have in place. And today there are so many online courses to really learn what's happening within this space. And it's easy to acquire these skill sets overnight, pretty much. And it was hard a few years ago, but today it is much more easy. So I really urge entrepreneurs to get on to machine learning and data science. I think that's where it is going to drive cognitive capabilities within the company. Thank you.
Thank you. Well, we run out of time. We would like to thank all the panelists for this great panel. Thank you. And if there are questions, the panelists here, you can approach them and having one-on-one questions. Thank you very much.